Well, it's 11:01. I think we'll get started here. I hate this COVID thing. I so look forward to seeing all of you in person on this day when we come back together. Um, but I guess this is as close as we're going to get today. I appreciate all of you joining us. We thought for an in-service today, it might be good to have some discussion about how COVID is affecting us, how we're going to move forward this coming semester. And so we're very honored to have with us today Dr. Rex Force, who comes to us as the Vice President for the Division of Health Sciences. And he's also heading up all of the COVID relationships with everyone external to Idaho State and keeping Idaho State on track in terms of what's going on around us, and has done a fabulous job in setting up everything that we've had to do to make all of this work for the universities. So we're really honored to have you with us today, Rex, and I'm going to turn the time over to you. We have a set of questions that have already come in that I think were forwarded to you, and then we'll probably let Ginny help us in the end with some any further questions that may come forward. So as we think about questions during this presentation, if you want to type them in, you're welcome to do that, and Ginny will sort of allow us to answer, or allow Rex to answer those questions as we get towards the end. So Rex, we'll turn the time over to you and let you tell us the latest, greatest.
Okay. Well, thanks, Scott. Thanks for the kind words. We've all had a long haul already, and we're here now at the start of fall semester, and doing our best to have safe in-person classes and mitigate the risk associated with COVID. Ginny, do you want to just kind of do your introductory spiel for doing the question and answer part of stuff, and kind of talking about how you make this work?
Yeah, you bet, Rex. Hey, everybody. Good morning. So we have a number of pre-submitted questions by the college. So we're going to start with those. Rex, is it easier for you if I ask these questions versus you looking at the document? I can just ask them live if that's okay.
I think I have them here, so I can read
Great.
off them and go through them. And if I don't cover things, either pop it into the chat or Ginny circle me back around to, to what needs to be answered. But I think I have the set of questions right here in front of me. Connie prepared a document from the information we got from you and Scott.
Perfect. Thanks, Teresa and Connie, for setting you up with that. So as I put in the chat feature, you can ask the questions publicly to everybody in the chat, or you can just find my name and ask them directly. And if you do that, then I'll ask them anonymously versus everyone seeing the chat. So please feel free to submit your questions now as we're discussing the pre-submitted questions, and we'll get to those as soon as we're ready for the live Q&A. If you have any questions at all about process or anything else about this, you can just send me a question on that as well. And we are recording this in case we have any of our colleagues who were unable to be with us for this meeting today. So I'll get this recording over to Teresa and she can get that out as well. So I will turn this back over to Rex and he can start answering these questions that you guys have asked. And thank you so much for submitting them. And Rex, I will turn it to you.
Okay, sounds good. Thanks, everybody. I see we have 100 people on already. We've done a couple of town halls already to answer some of these questions, so there may be some overlap with what you've already heard. We had several hundred participants on those calls over the last week or so. Again, trying to have a unified message. There's a lot of ambiguity. There's a lot of new information. When I was going through pharmacy school, one of my professors, you'd ask him a question and the first part of his answer would always be, "It depends." And that's kind of the way it is in healthcare, right? And we obviously are learning a lot as we go along. We're trying to incorporate all of that most recent learning. I get updates every day in my email, the whole COVID team does, about all kinds of new information that's being presented and published related to this. So things are changing. And I think that as we talk about what we do today, we also have to realize that we may need to be flexible because things may change. Even the efficacy of face coverings, right? That's been a big point of debate within the wider community and on social media. How well do face coverings work? And so there's now pretty good scientific evidence around the efficacy of face coverings. So that's just an example of how over the last few months, our learning curve has just continued to go up. The first question that I have on my list is, what should we expect the fall semester to look like? And it's going to look different, right? And I think everybody's been preparing for that. A good number of our courses are moved to a high flex model. We still have, as we always have, or at least for many years have had, a lot of online courses. The number that I've heard most recently, and this changes a little bit, is about 15% of our courses are going to be live and in person. Now that's diluted out a little bit by a lot of our other courses, meaning we have thesis courses, we have clinical rotations, we have a lot of other courses that count in the total number of courses that we offer. But we are going to have good physical distancing in these classes and the mandate to have face coverings as we deliver the curriculum. So that's a difference. We also expect that face coverings are used on campus if you're in the presence of others. So I'm here in my office by myself, my door is closed, I have windows open. That's fine for me to have my face covering off. But if anyone comes into my office or knocks on my door, my face covering comes on. I expect them to have one on, and then we can interact. We also maintain distance as best as we can. And we expect that people do that. That flows, I think, right into the next question. How should I handle a student who refuses to wear a face covering? We're going to have some difficult conversations about this on campus because this has been a controversial topic. But we've put out a lot of communication related to face coverings being required. For us to be safe, for us to be able to deliver our curriculum, we need to all be participating adequately in these disease mitigation efforts. I can give you an example. We had a simulation lab with one of our nursing programs. An infected individual, unbeknownst to everybody in that lab, was present one day. Virtually everyone in that laboratory space was exposed, right? But everyone was wearing face coverings. And although we had to stop instruction and we had to quarantine people, nobody in that group got sick. And that's because we had face coverings on in place, and we were being conscious about being within the bubble, that 6-foot bubble that we keep talking about. So those kinds of examples, I think, are important when we think about why we spaced our courses the way we did and why we're mandating face coverings, in addition to the other things: covering your cough and sneeze, washing your hands, staying home when you're ill, doing all of those disease mitigation activities. But we are going to have some situations where a student refuses to wear a face covering. In that case, we should offer them one. And if that continues to sort of flare a conflict, in some cases, those students may be asked to leave. If there's an ongoing issue that can occur, the professor has the option of moving, in some cases, and I realize that's not always the case in some of your programs in the College of Tech, moving some of that instruction to online. The Dean of Students, Craig Chatriand, also has some, I guess, interventions up his sleeve to work with students who continue to have difficulty adhering to the requirements in class. And so you could reach out to your program director, your dean, and then have communications with Craig about how to manage that, if that makes sense. The next question is, how should I handle a visitor who refuses to wear a face covering? That could be a patient, a parent, sorry, I have patients on the brain, a parent, a prospective student, someone like that. We'd ask that you have some disposable face coverings available. For example, at the front desk or reception area for your programs, so that you can offer that face covering to them. And I think that's the best way to handle that. There are occasionally medical reasons that individuals may not be able to wear a face covering, and that may occur with students as well, and they would go through disability services. Same thing with faculty and staff to sort of get that exception. For people visiting on campus, I think we should offer them that. If we see that it's going to cause a conflict, it's going to cause difficulty, I think the best thing to do is remain outside if we're giving a tour or in a large space, and maintain adequate distancing from that individual if they're going to insist on coming into the space and not adhering to our guidance. Most people, I think, if we have that conversation and we say, you know, within our facilities here on campus, we require face coverings, I think most people, even if they feel strongly otherwise, will still, for that short period of time, wear a face covering. But if it blows up into a big confrontation, you know, there's even the option of calling public safety if someone's going to make a really big deal out of it, I guess. I would prefer that we obviously have, you know, a conversation where we just talk about the respect that's present when we're protecting one another by wearing face coverings. The next question I have is, do I need to wear a mask when I'm lecturing, or can I wear a face shield? Will face shields be as protective? So the answer is you can wear a mask. I'm sorry, a face shield instead of a mask. Are face shields as protective? No, they're probably not as protective as a mask or a cloth face covering would be, and I use those terms interchangeably. We have many situations where a face shield would be preferred. We may have accommodations for some of the learners in the classroom, and they need to be able to see our lips move, facial expressions, things like that. And so it's perfectly reasonable while lecturing, while providing instruction, to wear a face shield. That's been our policy for quite some time as we've been planning this out. Are they as protective? No, we want to make sure we maintain distance as best as we can. A lot of us, when we talk and lecture, we want to wander. I would say, you know, try to stay in that bubble that keeps you at a decent distance from the students in the classroom. And as I'm doing these, if there are follow-up questions, just shoot them to Ginny and we'll circle back to them. I've heard that masks really don't work. Why should I wear one? Well, that's not correct. Masks do work. And in fact, there's been a lot of research on this. Masks work to protect ourselves, and even probably more so to protect others. But when we use them in tandem, that is, somebody who's speaking with me is wearing a mask and I'm wearing a mask and we're maintaining distance, the risk of infection is pushed almost towards zero. And so it is very clear from all of the literature that's out there that wearing face coverings substantially decreases our risk of transmitting infection and receiving infection from others. So I don't think I could be more clear. There's a lot of evidence that shows that face coverings decrease disease transmission. And to be perfectly honest, if we all got on board in the entire community and did that for a month or a month and a half, we could literally snuff this out. If we maintained distance, we didn't gather in large groups, we wore face coverings, we did all those other disease mitigation efforts, we would snuff that out. I'm pretty confident that that would occur. Next question. COVID-19 has brought on a lot of extra stress for faculty, staff, and students. Workloads have changed, expectations have changed, our curricula have changed. What are the tips or resources to help us get through this? Well, let's start with students. Our Counseling and Testing Center has obviously been gearing up for exactly this. That this creates another level of stress for students when they come back to campus or have been on campus. Many of our programs, and I know some of your programs, have been running all summer. So absolutely try to identify those students. I think our students need extra care, extra contact, extra communication to be able to identify those students that may be struggling. They have lots of other stressors already, and now we've layered in this additional major stressor in their lives in terms of dealing with COVID. It's affecting daycare. It's affecting work outside of school. It's affecting all of these things. It's obviously maybe affecting spouses and their ability to work. So the stressors have really increased. And I think it's important that we recognize that. Referral to our counseling center is absolutely recommended. For employees and staff, obviously talking with them about stressors, supervisors being engaged and trying to identify stressed employees, faculty, instructors, staff, everybody. We need to pay attention to that. We still have opportunities for telework. So if being in the office has created additional levels of stress, I think we should consider telework options. And obviously we have an employee assistance program where finding counseling or somebody else to talk to is something we definitely can do and can recommend to those around us. Just talking about this, talking about the frustrations is extremely important. It gets old, right? It's in the news. It's everything that we're doing. We probably go home and talk to our significant others or our kids or our friends about this, and it gets old. That just heaps the stress on. I would recommend that people continue to exercise, to get outside, to do things that are normal stress relievers for them. Staying in shape and exercise is an extremely important stress reliever just for general health, but also important at this time. And obviously we still have some good Idaho weather to enjoy. So those are some of the tips or suggestions that I would have moving forward. Those are the questions that I have on my sheet, Jenny. So I'm happy to take some follow-ups to those if they've come in, or move on to other questions, whatever people like. Scott, I don't know what your time is like, if you want me to talk for an hour, or whether or not there are, there's other business you need to cover.
No, we're going to have our all-school meeting this afternoon, so this hour is pretty much dedicated to this discussion. But it might be good for everybody to hear sort of an overview of the COVID committee and how that committee works, who serves on it, and sort of how if something comes up, who we contact, and how that committee works in terms of handling those things that come up.
I'd be happy to do that. Ginny, I have just a handful or two of slides that we have created for this kind of communication. Am I able to share my screen?
You are now.
I am now? Okay.
Mm-hmm.
All right, let me see if I can pull this up real.
And while you're pulling that up, Rex, I'm going to share the information that went out on employee training. And if you haven't taken that training yet, there's quite a bit of good overall condensed, clear and concise information that will address some of this as well. So I just posted that.
Just a second here. Sorry for the delay. I'm just getting it queued up here. Yeah, I think the employee training is excellent. And really comprehensive. So as Scott alluded to, we've had several different committees that have been working on Roaring Back. That's coming back to in-person instruction on campus. And these committees are chaired by the individuals listed here: Katie Thomas, Craig Chatrand, Blake Beck, and Chris Boyce. The health committee is made up of Chris Boyce, who's our emergency management coordinator in our public safety department; Cassidy McKay, who's a faculty member in the Department of Family Medicine and Pharmacy Practice. She's what we call our COVID coordinator. She's our point person for all the campus-wide communications and the points of contact for questions and case reporting. We also have Ryan Lindsay, who is our chair of the Department of Public Health. Chris Owens, who's our Associate Vice President for Health Sciences. Jen Parrott, who is with our Environmental and Health and Safety team on campus. And Ron Solbrig, who's a physician and the outgoing, he's announced his retirement, but is still very much engaged in university health and has been running university health for the last 8 or 10 years. So we have a good representation of folks on the health committee, and these individuals are also sprinkled into the committees up above so that we have sort of a good coordinated voice related to health for the employee, student, instruction, and community committees. There are a bunch of helpful resources on the COVID webpage, and if you go to isu.edu/roaringback, you can link to a whole bunch of frequently asked questions, things like travel guidance, our health exception process. There is a link there for the number of cases that are occurring on campus each week and a little bit of detail around that. There is our voluntary self-reporting form. So if you or a student or a staff member tests positive or has been exposed, we ask that you voluntarily report that, and then we will have a whole process kick in that is coordinated with the health department for contact tracing. So this is how we would address a case in class, for example. And we have a team that's forming up for us to be able to address positives on campus, whether it's in the dorms, on our athletic teams, or in the classroom, or in a non-academic unit on campus. This web page also has links to our operational levels. And so we have a green, yellow, orange, and red operational level. I know orange is our favorite color here on campus. We'd really not want to go into the orange category on our operational level. So orange is not good when it comes to where we're operating as a campus. Those operational levels are set for our Pocatello campus, our Meridian campus, and our Idaho Falls campus. We know we also have students in Anchorage, Alaska with the College of Pharmacy, and also in Twin Falls. We sort of coordinate our response and our operational level with those parent campuses, if you will. There are some definitions that float around and that we talk about all the time. What's a close contact? A close contact is within 6 feet for more than 10 minutes, and we're using cumulative time. So if you have an hour class or even a 4-hour class with students, and you are within that 6-foot bubble for 10 minutes or more, and that student, for example, turned out to be positive, that would be considered a close contact and should be reported through our online form. We will then contact you, and we'll begin contacting and coordinating the other potential contacts that were within that classroom, within that lab, within that office space, whatever the case may be. Secondary contacts are contact with someone who's had close contact with a positive case. We get lots of confusion around that, right? The infectious period for COVID is another thing we need to pay attention to. Most public health guidance says that if we have contact with an individual who turns out to be COVID positive in the 72 hours before symptoms appear, that is the infectious period. We also ask those individuals who have been infected with COVID to isolate for 10 days because they could be potentially infectious throughout that time period. There are two other terms you hear a lot: isolate and quarantine. Self-quarantine is used for individuals who are exposed but are not yet ill. Okay? Isolation is used for those who have illness and have symptoms. Okay? Those are and some of that's public health terminology, but that's why you hear those different terms. Quarantine is if I get exposed to someone and I need to stay at home for 2 weeks. Isolation is if I actually come down with the illness or test positive, I then need to isolate, usually for 10 days. Depends on symptoms and how long they last and how severe they are. So we have a lot of contact tracing efforts that are going to occur on campus. These are initiated for positive and probable cases, and we will have a group of ISU contact tracers that will work and be trained by and coordinate with, use even the same data systems as our local public health department here in Pocatello. So we're training up a team that will be a part of the public health team, but will be dedicated to our campus. If a student informs any of you that they are positive or probable, gather some information about the contacts and about the 72 hours prior to the symptom onset, particularly as it relates to our operations on campus. And you can send an email to covid@health.isu.edu. This is a secure email system. You can ask those students to fill out the online form that we talked about, or you can call our COVID hotline at 2705, extension 2705. Close contacts are those who are within 6 feet for more than 10 minutes. And close contacts need to quarantine for 14 days. We also ask that you not release information about contacts or positive cases to other interested parties until you have approval from the health team. We're dealing with HIPAA-related issues. We're dealing with FERPA-related issues that we'll talk about in a minute. And we don't want to create a panic when we don't need to. And we want to make sure that we gather all the information and understand the case before we then reach out to everybody. So this whole process will play out. We've got your back. We're going to be working with you, but we don't want to incite, panic or undue concern if it's not necessary. And that's why we've spaced our classrooms. That's why we're wearing face coverings, because we want to decrease the risk and decrease the number of contacts. Does that make sense? So let's talk a little bit about FERPA. We're working under FERPA primarily as opposed to HIPAA when we're talking about students. There are some privacy issues related to the medical side of this, but primarily FERPA is paramount. And I don't have the details on this next statement, but because this is occurring on campus and FERPA is involved, positive results become part of the academic record. And this is under guidance from our new general counsel, Blake Christensen. I don't know how it's going to get transcribed, so to speak, but it is part of the academic record. Part of this is also related to Clery reporting. You may have heard about Clery reporting. That's about crimes on campus, sexual assaults, other types of assaults, drug offenses. Those have to be reported because of because we receive federal money for our financial aid programs and otherwise. Epidemics and pandemics also need to be reported as part of Clery. So as we gather this information, we will be disseminating it, and that's one reason we have the web page up that talks about the cases that are on campus. The university can release information if the student's presence in class constitutes a significant risk to others. So the point is, we do that investigation, we identify the risk to others, and then we will inform others of that risk, okay, and provide education and guidance for that. The health committee will do that determination if the risk is significant enough and how broadly that notification goes out. We're not going to hold back information, but we're going to follow the guidance from our public health colleagues to make sure we're informing the right people at the right time through that contact tracing process. What should you do if you're exposed, if you're ill, if you have a colleague that is exhibiting symptoms, if you have a student in class? First of all, you stay home. We don't want you on campus if you're ill. And it relates to all of these COVID-related symptoms: new onset cough, fever, shortness of breath. Sometimes there are what we call GI symptoms, diarrhea, vomiting, things like that. Loss of taste and smell has turned out to be an uncommon but a unique finding, somewhat unique, of COVID. So there are a group of symptoms. Those symptoms are available on the COVID website. And first of all, we don't want sick people on campus. We also don't want people self-diagnosing and saying it's just a cold, it's not COVID, or it's allergies, it's not COVID. No, we want you to get assessed by your primary care provider. If you don't have one, you can be assessed at University Health, but we don't want you in the workplace or the classroom if you're exhibiting those kinds of symptoms. Sore throat, runny nose are also COVID-related symptoms and can obviously be lots of other conditions than COVID, but we want a very, very low threshold for staying at home and getting assessed, not bringing illness into the campus environment. You can self-report on the form if you have COVID-like illness, if you have exposure, or if you actually have a positive test. And we will follow up with you on in short order on those symptoms and provide you with guidance. And you should contact your provider, as I just said, to discuss the need for testing. If you don't have a provider, University Health and our on-campus testing center will be able to provide testing if it is indicated, if it's appropriate. We also have these operational levels. I've already touched on this. It's a color-based approach. It's on the website. We use more than a dozen different metrics looking at each campus to determine what category it's in. We then provide a scorecard to the administrative council, and they make the determination for which color code we're operating under at each campus. So the health committee gathers all the data, presents it to admin council, they make that decision. We also have a weekly numbers update that I referred to. That number shows you the number of cases in the last week. We collect data beginning on Wednesday, go through the next Tuesday, report it in a row on that table. We give you a little bit of additional information. Is it students or faculty and staff? Where, meaning which campus is being affected? And we provide a few other descriptors as necessary. We also have to track what are called clusters. And that is if we have multiple cases, right now it's 2 or more cases in a classroom, in an office suite, in a group of workers, in an athletics team, whatever the case may be, we call that a cluster. And we track those clusters and we report those clusters out. That is just kind of a high-level overview of the activities of this committee, Scott. And I'm sure there's some questions that have come in, Jenny. We still have a half an hour. We can start plowing through those questions if you want to. There may be some questions related to this brief presentation too.
Jenny, I think that question from Dr. Steve Clay might be a good one for Rex to discuss right now as it relates to this presentation.
You got it. Thanks, Scott. So the question is, does this mean one symptom should prompt an employee to stay home, or should the bar be multiple symptoms?
I think for most, it's going to be multiple symptoms. Now, not everybody has every symptom is the problem. And even a fever, which is a fairly common symptom, is still present in generally less than half of the individuals. So if people have a fever and a cough, 100% they should stay home, right? Those are classic for COVID. If somebody has diarrhea and a cough, absolutely they should stay home. A runny nose, that's a little bit more of a judgment call. But the other piece of this is, how do you feel, right? How does somebody feel? Because with a viral illness like this, even if runny nose is the primary symptom, they might have a little bit of a headache, or they may feel tired, or they may feel otherwise. And so, there is a bit of a judgment call here. And, I have seasonal allergies. They always kick up in August and September. I'm trusting that if I have to blow my nose a couple times a day, that it's probably my allergies, because I'm feeling nothing else, or nothing else has changed. I have no scratchy throat. I have no cough. I have no headache. I have no subjective fever. All of those things. So I think what you're asking is a reasonable thing, that maybe a single isolated symptom is not that concerning. But you could always call and ask and talk it through, because not everybody is thinking through everything else that they're feeling. And we're not all the same in terms of perceiving how we're feeling each day, right? And so it's very reasonable to call your provider, call the COVID hotline, and we are happy to talk through that with you and try to make some assessment over the phone.
Okay, thanks, Rex. And then I think the question about attendance was raised as well. So our program has in the past had an attendance policy. Now that students are being told that they need to stay home whenever they're sick, without worrying about it affecting their grades, some students will take advantage of this and not come to class whenever they don't want to. What do you suggest we do about such behavior?
Yeah, it's going to be hard to sort that out, right? Because we've really lowered our threshold for trusting that people are telling us the truth and that they're staying home for the right reasons. Clearly, if somebody tests positive and they share that with you as an instructor, they're going to be out of the classroom for 10 days minimum. If somebody is exposed and we have to trust that they're telling us the truth there, we don't want them in the classroom until they finish their 14-day quarantine. It's actually longer, potentially, if you're exposed than if you actually get the illness and get over it in that 10-day period, which is kind of, it doesn't make intuitive sense, but that's the way it is. We obviously have to be flexible with our attendance policies to keep ill people out of the classroom. If we have somebody there, it's going to shut down all activities for potentially 2 weeks, right? So I think we have to err on the side of trusting this. I understand people will take advantage of it. I understand that it's difficult to do makeup work when we're doing so many hands-on kinds of things, especially in the College of Tech. We have that in health sciences too, right? We have rotations, we have labs, we have all of these things where people need to do hands-on kinds of activities, and it's difficult to make up, but we're going to have to be flexible and come up with plans to be able to do that as we move forward here to keep campus safe.
Thanks, Rex. Next question. I just called the ISU COVID hotline because we received a phone call about a student who has not been on campus at all, but has tested positive for COVID. They want to return to classes, but want to know what is needed first. How do we need to proceed?
So if you have that student name and have shared it with the hotline will reach out. We may need to get contact information for that student to provide them with guidance. Obviously, all of this is a timeline, right? We've talked about when you're exposed and when a positive test occurs, and then how long somebody is ill, right? So there's a lot of individual information that we need to gather from each case to then be able to say, okay, you can come back to class next Wednesday or 2 Wednesdays from now, or whatever the case may be. So it is individualized. We don't need you to count the 14 days or 10 days. We'll walk through all of that with them. There are some people that maintain illness and fevers for much longer than that 10-day period. So they're going to be out of the classroom even longer. So again, it's an individualized situation. You provide us with that information. We'll reach out to the patient, to the student, and we will we'll provide them with the right kind of guidance. And then we'll feed it back to you too, so that you know that that student is obviously very interested in initiating their studies. They're very disappointed to not be there on the first day of class potentially, but they will be there if everything goes well, at a later date.
Okay, thanks, Rex. Next question. Based on Southeastern Idaho Public Health website, all counties are considered minimal risk. Per the COVID-19 regional response plan, the metrics being monitored have benchmarks for when the risk level will be elevated. In Bannock and Bingham County, the active cases have exceeded the benchmark numbers. An example of this is benchmark data for Bannock County is 88 active cases for 3 consecutive days. The county exceeded 88 active cases on July 24th, 5th, 6th, 7th, 27th. SIPH did not elevate the risk level for or release any public statements. My question is, how is the ISU COVID team making informed decisions? Is ISU relying on SIPH, or are we monitoring the data such as positive percentage rates and making decisions based on that data? Unfortunately, it seems a lot of organizations are only following SIPH guidelines. However, they are not following their own published plan.
Yeah, it is a really good question. And I've had the same frustration. In fact, I have almost daily communications with Maggie Mann, the director of public health for our district. And I texted her the other day and I said, why isn't Bingham in the yellow? And her response to me was, if it was up to me, it would be. Unfortunately, I guess, And this is the structure of our health districts. There is a health board, and those individuals have been making the decision. They've been working every 2 weeks to determine the level of concern, right? The green, yellow, red for the health district. The health district's metric, and I agree with you, Bingham for sure should be in that category, and Bannock has bounced around. We've had a bunch of new cases within our county in the last few days. I haven't looked at the website today. I'm trusting that you did to put those numbers in there. And the reality is Bannock has been close many times over the past month or so. But it has not been voted on by the health board to move them into the next category. That's been disappointing to me. That metric is only one of our metrics for determining the operational status of the campus. We look at how many quarantine beds we have on campus. We look at the number of cases we have. We look at the trends in the community, absolutely. We look at the percent positive tests. We look at testing availability and who's getting tested. We look at a lot of different factors, and then we come back with that scorecard that I outlined earlier and provide that to admin council. If you look on the website, I think our level is at yellow. And that is what the admin council voted yesterday, to move the campus to a yellow level. And that's sort of in contrast to where the district health department is. So I totally hear what you're saying. Some of this is frankly political at that level, not necessarily evidence-based or just based upon the metrics. We're trying to provide admin council with a bunch of different metrics. Most of them are very data-driven. Some of them are a little subjective. That is, how many people, what percent of people are wearing face coverings on campus. That's one of the things that we look at, and that's fairly subjective as we walk around campus and talk with others. But those are the kinds of things that we look at. We look at a bigger picture, I guess is what I'm saying, than the health district is looking at.
Okay, thanks, Drex. I have a follow-up question about the attendance conversation, and then I'm going to pause and take a quick beat to have Karen discuss support for College of Tech students. So the question follow-up on attendance is, in response to Steve Clay's question on attendance, would it be reasonable to require some remote work by absent students depending on how ill they are? That is easier for me in math than for Steve in machining. However, the work could encourage students to remain involved.
Yeah, so I think it's very reasonable to provide students with makeup work while they're ill. Now, you know, we don't know the severity of illness or the duration of illness for all those students, but I think it's very likely that in the demographics of our students, that is relatively young adults, and I know it varies, that the illness and the course of the illness is quite mild. Now, that's not the case in everybody. And when I say quite mild, a 2 to 3 or 4 day period of not feeling well. And, you know, very frequently there's a day or two that are pretty sick and people are very fatigued and are going to want to spend most of the day in bed. But they're going to be out for a minimum of 10 days. So I think it's very reasonable to provide them with work at home, or at least the option of doing that, recognizing that they're going to have to make it up at some point during the semester anyway.
Perfect. Thanks, Drex. I'm going to take a quick pause to turn it over to Karen Ludwig to read her statement about the Center for New Directions being available to help with mental health and emotional support. Karen, can I ask you to pop on?
Thanks, Jenny. I just wanted to clarify, I think most of you know we do have some newbies, so I just wanted to make sure that everybody understands that Center for New Directions is actually the College of Technology Counseling Center. So if you refer students to counseling and testing, they will just refer them to us, and it's just an extra step in the process. And we just want you to know that we are available now and for the rest of the semester to help students who need any mental health and emotional support with this extra stress that's happening with COVID, with regular school stuff, with all the stuff we always see students about. We are doing Zoom counseling for the fall in order to minimize the risk for both us as counselors and students and the people on the floor to, you know, if we can keep a student from coming up to the floor and they can do their counseling in the comfort of their house, then we think that's a great place to do it. If you have a student who's in crisis, we would ask this fall that you, if you're with that student personally, rather than walking them up, you just give us a call and we will get that student online with a counselor, and then the counselor and the student will sort of figure out what to do after that. We want you to know we'll be coming out to your programs next week with student services. We'll be talking to students about at new student orientation about what our services are and how we're available to them. And then there's also the statement on services that we hope you'll include in your syllabus again this year. If that hasn't been sent to you, when we get finished with this meeting, I'm going to send that to Teresa and ask her to send it out via COT computers. And we hope that you'll just copy and paste that statement on services, which is just sort of a wellness statement encouraging students to use their resources, including counseling, and then information on how to contact Center for New Directions to get connected with a counselor. If you have concerns about a student, maybe you've suggested they get a counseling, they're not being responsive to the connections that you're trying to make with them, then please call me and let's consult. You can call my direct line at 6076, and I'd be happy to talk to you about any particular situations that you have and how we can best get some supportive services to that student. So thanks, Jenny. I appreciate it a lot.
Thanks, Karen. That's great information. Rex, our next question, can we discuss the unique challenges our health occupation students will face? Many work in healthcare. How will their work exposures in class? We can't really tell them to stop working, and they need to be in lab. The whole exposure of 10 minutes, even when wearing PPE rule, has a big impact on these students. And this is, of course, something that affects your area too.
Yeah. First of all, let me say, Karen, I'm sorry. I didn't understand fully the structure and all the resources that were available within the College of Tech. So I didn't mean to divert people to central campus counseling and testing when all those services are available there. So thanks for hopping on and clarifying that, because I wasn't aware of that, of how all that worked. Related to clinical rotations and work, obviously there are a ton of concerns as we send students out into the community and as they're working in the community. We've gotten questions about this. We get questions nearly every day about this kind of thing. And we've had, currently are working some cases where students on clinical rotation are infected with COVID. So it affects their educational experience. Some of those students come back to class or could come back to class or lab and then affect and infect the educational experience of other students here. Part of this is we have rules and we follow those general guidelines from the CDC, from OSHA, from wherever the sort of health authority comes from for the recommendations that we apply. And so, yes, it affects these students. They're at risk out in the community if they're working. We know that when they're wearing PPE, there is some level of protection, but when we investigate those cases, we tend to ignore that level of protection, to err on the side of diagnosing more cases and limiting spread. So that's why that is done. I know that it impacts their ability to work. It impacts their ability to come to class. And it creates all kinds of complicating factors. There are situations where, as a healthcare provider, so let's say we have somebody who's a CNA and they're going to, they're in the LPN program, or they're in another program in health sciences, or whatever the case may be, but they're working out in the community, they become infected. There are certain cases where if they're not particularly ill, they can continue to work as long as they're caring for COVID patients, right? I mean, there's no transmission of infection in that case, because they're already caring for other infected individuals. And if they're feeling well enough to do that, that's one thing that healthcare facilities have been doing to keep the workforce intact, right? But we don't want that person coming to class and potentially infecting a bunch of other individuals or our faculty and staff that could be at higher risk.
Thanks, Rex. We have a follow-up question about contacting the COVID hotline and the ISU Health Committee. So some of our employees work with people kind of one foot into the college and one foot out. So working with GED, ESL students, So they attend the classes, but they're not ISU students. Would they be treated exactly the same in terms of reporting any instances?
You know, I have to say we haven't had that exact discussion. But if I'm gonna talk off the cuff here a little bit, if they're part of our campus community, they're coming on campus, they're interacting with our employees or instructors, I think we should treat them that way. Treat them as part of the ISU campus community.
Great, thank you. If an employee travels out of Idaho, do they need to quarantine before returning to work?
So there's a lot of travel guidance out there. And I would say that in general, we don't want people to travel. And we certainly have a clamp down on even official ISU travel. It really needs to be essential. That being said, there are many places in the US that are better off than Idaho is right now. And if you look at some of these websites where you can look at the state rankings for rates of infection and otherwise, Idaho's quite a ways up that list. So if we're traveling to areas of very high disease activity, we want to talk that through with our supervisor. We want to talk that through with potentially your dean. And in some cases, depending on which operational level we're in, that travel, if it's an ISU travel, requires vice president level approval. For personal travel, the university really hasn't taken a stand on that other than asking, imploring, begging people to be smart about the travel that they do.
Okay, thanks, Rex. Next question. This is more of an HR question, but I'm hoping you know the answer, Rex. How does it work with our sick time? Does our sick time get docked if we contract the virus and have to stay home?
I don't actually know the answer to that. I think that, like any other illness or a surgery or other things, I think that it will come out of your accrued sick leave. I'm not 100% certain though.
That's my understanding as well, Rex. I'll see if I can get an answer from HR as we're discussing other things.
I don't know why it would be different. I mean, I know it's a unique circumstance sort of with COVID, but if you contract the illness, I think you have to take sick leave. I think that's what's been discussed.
Okay. Next question. Does this mean, oops, sorry, already asked this one. So Mark Sharp has shared a wireless video headset that might come in handy for the instructors. I'm going to pass this on to our Roaring Back committee chairs. So thanks for sharing that, Mark. Okay, next question. Students in clinical rotations may come in contact with COVID positive patients. If they're wearing appropriate PPE, are they able to come to in-person class or do they have to stay home? What do we do with students who work in healthcare directly with COVID patients? Now this is, you've addressed most of this, but directly with COVID patients.
Yeah, I think that we have addressed it. If you have a contact with a COVID positive patient, out in the community, we need to have you self-report. We need to encourage that student to self-report, or even if it's a faculty that has these or a instructor or staff, we need to self-report and the COVID health team will engage and provide you with guidance. Generally speaking, we don't want those students coming back to campus and we want them to quarantine. If they become ill or test positive, then obviously they're going to be isolated and be managed for their COVID-related illness.
Thanks, Rex. Next question, how does the upcoming flu season factor into the COVID response, et cetera?
So that's a very complex question. And there's no question that as we get more other what's called influenza-like illness, ILI, we need to then separate out what's influenza, what's the common cold, what's COVID. We are ramping up our testing capability, including ramping up our ability to do what are called rapid tests. That's like you've ever had a throat swab for strep throat. They can tell you within about 10 minutes with reasonable certainty whether or not you have strep throat. Those kinds of tests are becoming more and more available for COVID, and that will help us to differentiate between COVID and other influenza-like illnesses. Those kinds of tests are already available for influenza. So it's going to require more testing, more follow-up with your providers and getting tested so that we can separate that out. Obviously, we don't want people with influenza to come on campus either, because that causes absenteeism and there are complications with influenza-like illness. Not quite to the extent that that is occurring with COVID, but we have deaths due to influenza every year. So it will require more diligence in making the right diagnosis and separating that out. I would also say that I would encourage everybody to get a flu shot, because that will limit the complicating and confusing illnesses that may occur in you with an effective flu shot. And I know there's people who have their feelings about the flu shot for influenza, but it is an effective intervention to decrease absenteeism. It's cost effective, and it has been shown to decrease the complications associated with flu too.
Okay, thanks, Rex. Follow-up question. In watching testing videos, do they really need to test brain matter to determine if you have COVID-19?
You mean with the depth of the swab? From what I haven't had it yet, I probably should do it just so I experience it. But my understanding is that it's not very pleasant. That is a very deep nasal swab with not the nicest feeling, kind of a Q-tip kind of a thing. There are salivary tests and these antigen tests that may not be quite as unpleasant as that. And you know, it's really disappointing, I think, for some people when it comes back negative, right? If you're going to go through that, you might as well have COVID. But you're right. People have really found that the testing itself is not, the swab is not very pleasant. So.
Okay, and related question, if you are symptomatic with COVID-like symptoms, is it possible to get a negative result when you're really a positive?
So false negatives, that would be called a false negative, meaning you have the illness, but the test said you didn't. They are positive. And so you will see reported, for example, on the Southeast Idaho Public Health webpage, probable infections. These are people who have the constellation of symptoms that it basically, if it you know what they say in medicine sometimes, if it looks like a duck and it walks like a duck, it's probably a duck. And if people have all of the symptoms of COVID, they are included in that probable category, even if their test was negative. Some of those individuals go on and get another test. Sometimes it's positive, but a false negative is possible. It's partly related to the technique of testing, right? If that technique is not done adequately, that's one reason it's such an unpleasant test, is because they really have to get a decent sample out of the nasal cavity. If they don't, it can be a negative test, and then it's a confusing picture. So usually when we're dealing with a pandemic, if somebody looks like they have this infection, we're going to call them probable, we're going to treat them as a probable, and we're going to treat them as a positive in essence, and they're going to stay home for 10 days until they get over the illness.
Okay. Thanks, Rex. And I have a note from Teresa who tells me that the College of Tech will again host a flu shot clinic this fall, currently scheduled for October 16th, 3 to 5 p.m., and more info will follow from her to the group. So I have a question for you, Rex, on could you briefly review the steps to take for students that refuse to comply with required masks and distancing?
Well, I think the first thing to do is have a private, courteous, supportive conversation with them. I also think that we need to have face coverings available when people don't bring them. So somebody comes in, we can hand it to them and we can say, you know, face coverings are required on campus. It protects all of us. It keeps us in the classroom and keeps your program running. If we have repeated violations or repeated issues in a class or in a cohort, I think you need to reach out to Craig Chatrian and the Dean of Students and begin talking about how we're going to deal with that. And I don't like talking about disciplinary kinds of things, but there are disciplinary kinds of things that can be done in order to protect the rest of the class. And it's not a joking matter. This is important. We want our programs to be together. We want our students to learn together. We want our faculty to be engaged. We've had some scares, even in College of Tech over the summer. And, you know, we want to mitigate that. We're going to have them. You know, we know this is going to be an issue. Not only the not wearing of face coverings, but even when we do everything right, we're going to have to deal with this illness. And the reality is it's real. Most cases are not bad, but the reality is in certain populations and with certain individuals, it absolutely can be devastating. And so I just want to emphasize that we're all playing the odds a little bit here, but I want to put as many of the odds in our favor as we can.
Great, thanks, Rex. So I wanted to add to that too, that I confirmed with facilities this morning that we are stocking podiums and classrooms with boxes of temporary or disposable face coverings. So if you have a student who forgets a face covering, those will be available. Additionally, any of your office managers, people who manage departments, they can order disposables via our Bengal Depot offering. So I'm going to put that link here as well. So meaning that you can get some disposables to keep on hand, either in your public spaces in your area or for stocking your faculty members with disposables so they can be ready with a solutions-based approach for students. But because of course, that's an important touch point for all of us. Okay.
I think that's a really good point, Jenny. You know, people have asked, are we going to have kind of a little station or a little box of masks at the entrance to doors? I think distributing them through the office managers is a better approach, because we had a lot of thefts of hand sanitizer and toilet paper and all kinds of things when the pandemic broke out. So I think we're going to have a little more controlled distribution of the masks, but they are available for just about anybody. We've got tens of thousands of masks in stock right now.
Okay. And then I got Katie Thomas to join us to answer the HR questions that were previously submitted, the one being about leave and sick time. So she's on here and is going to talk to us about that now. And I know we're at the 12 o'clock hour, but we have just, I think, one more question after this, and then we'll let you guys go. So Katie, can you answer that question for us?
Yeah, can you tell me the question specifically? Sorry.
Yes, you got it. So I think I'm rephrasing here, but the question was, if I contract the virus and am out sick, have to quarantine, do I have to use my sick time? Will my sick time be docked? What's the question?
Okay, gotcha. And are we talking employee or student employee?
Employee.
Employee, yeah. So if you are ill or if you are exposed or have to self-isolate or quarantine, if you are able to keep working remotely, you are absolutely able to keep doing that. So if you feel well enough, you talk to your supervisor and you want to keep working remotely, that's totally fine, and your sick time and vacation balance will not be automatically docked. If you aren't feeling well and you want to use your sick time, you're welcome to do that, and you just enter the sick time just like you would in any other time that you're sick. Additionally, there are some extra leave options. So the federal government approved the Family First Coronavirus Act in April, which is still good and active through the end of this year, and I think they're looking at expansions to that now. But there are some additional leave options that are particularly related to COVID situations. So if you aren't working remotely and you don't, or you need to use a leave option, I would say work with your supervisor and HR to explore the leave options that are available, and then you can decide which one you want to use. So it doesn't happen as an automatic docking of sick time. Does that make sense? Okay.
Does to me. People will let us know if they have any follow-up questions. Katie, thank you so much for hopping on with us for that answer. Really appreciate that. Okay, so Rex, we have two final questions for you. One is, if local school districts cancel or change classroom attendance, is there any plan for ISU to adjust their activities?
So the short answer is no, we're not going to necessarily parallel what happens in the local school districts. We are obviously working in concert with the local health department. And I realize that with changing classrooms and classroom activities in the school district affects whether we have children in the home and online learning in the home and the ability of people to work if daycare, for example, isn't available or babysitters are not available for kids. But the answer is no, it's not going to affect our operational status. However, I would say that if the school districts are having to make major changes, we will be following all of the public health guidance that's out there, and likely it may affect our operations, but it's not because of what the school districts are doing, it's because of what's happening in our community and prompting those changes within the school district.
Great. Thanks, Rex. So there was a question that came up about how many days a student could miss a class before they have to medically withdraw. I'm going to pull that one offline and give that to the instruction rowing back committee. So I'll get that answer to Teresa. And then last question for you, Rex. If any of my family members contract symptoms of the virus, should I self-quarantine?
The short answer is yes. If your family members have symptoms of the virus, they should be tested. We have drive-up testing and walk-up testing at Holt Arena. Those test turnaround times are getting shorter. We're actually going to stand up even more testing capability in Southeast Idaho and here on campus. So testing is key to find out if it's really COVID or not. The tests, even though we talked about false negative, the tests are highly accurate. And so a false positive with the kind of tests that we do is virtually unheard of. False negatives occur if we don't get a good sample and for other unknown reasons. But if somebody has symptoms and it looks like COVID, you should quarantine until we rule in or rule out. And if we rule in, then you're going to be stuck at home quarantining if you've had exposure to that individual. And the public health department and the COVID health team can, again, help to define what that exposure is and whether it's safe and when it's safe to come back to campus.
Great. Thanks, Rex. And I'm going to turn it over to Scott again.
Well, Rex, thank you so very much for your time this morning. This has been absolutely informative and super. I know this will save us a lot of questions, especially going through my office. So I really appreciate it. But thanks for your time, and thanks for all the hours you're putting into helping all of us stay safe and do what's right on campus. Appreciate your time.
Yeah, thanks, Scott. And Katie has been doing the same for the employee group. And we've got, I mean, it's been a whole team. Everybody's been working very, very hard. So Ginny's been on these Zoom meetings, I think probably 24 hours a day, it seems like. So lots of people have had and a whole lot of new work to do. And Katie, I just wanted to say thanks for jumping on, because there were some nuances there with leave that we weren't covering quite right. So I'm glad that Ginny was able to grab you and get on here quick. Thanks, Scott, and thanks everybody, and have as productive and safe a semester as we can. And again, we're here to help. Let us know if you have questions, because that's really what this committee and all this information is about. And it's really difficult to have just a black and white answer for some of these questions. So it's best to talk it through with us, and we'll be able to provide you with guidance.
Thanks again, Rex. Thanks, Ginny, for all of your help. You did a super job. We appreciate it very much. And to my faculty and staff, we will see you in an hour for our all-school meeting. Thank you.